Okay. So again, we are coming to the similar trap and rescue issue. Trap and rescue in the chest X-ray, very common X-ray in your AKT exam, even in the OSCE. So trap one for you now. Try to be safe from the trap. This is an X-ray. Your patient is hypertensive, whatever AKT or OSCE. What you are getting near here? What is your observation? What will be your diagnostic formulation? Please, anybody respond? This X-ray given to you in the OSCE.
Hypertrophy, left ventricular
Left
hypertrophy.
ventricular hypertrophy. Is there any cardiomegaly? Is there cardiomegaly? Trap is it pneumonia, tuberculosis, or hypertensive heart disease? That was the trap there. I am again showing you. Now think. This marked area can confuse you. It will be your trap. So will you tell this is pneumonia or TB?
Hylar lymphadenopathy. So it could be TB.
It could be TB, but your patient is hypertensive. You are dealing a patient of hypertension in the OSCE station. Your background is hypertension without any other problem. Patient doesn't have fever, doesn't have cough, but your X-ray appearance is like that. Okay. So if cardiothoracic ratio is more than 50%, it is chronic hypertensive heart disease, not pneumonia, not TB. So these are some fallacy, okay, puzzling features here. But cardiomegaly there in hypertensive patient, your straightforward answer in the exam will be hypertensive heart disease, maybe left ventricular hypertrophy. Now the second trap in the X-ray. Look at the X-ray, doctor. Your patient is hypertensive. What you are looking here? Please try to be with me in the discussion. Give your answer, please. Please. No one. What you
I
are
think
looking? Yes, Dr.
step
Javed.
is this in the center. I think sternotomy is done maybe because of
Sternotomy wire.
this. There are clips visible in the center, so
Okay, this
maybe
is a clip. It is wiring for a sternotomy. Midline sternotomy. Any other observation? Your patient is hypertensive.
and other is bilateral congestion in the lungs,
Bilateral congestion. Can you mention the name of type of congestion?
a pulmonary edema maybe.
Bat's wing appearance. Bat's wing appearance, right? Metallic valve also they are one. Metallic valve. Which valve could it be? Metal. Doctor?
Yes,
And the blunt costophrenic angle also there. A little blunt is there. So
on
what
the
is the
right.
summary? What is the summary of hypertensive patient now?
So I think already valvotomy done. I think maybe mitral valve. I don't know mitral valve.
No, this is observation. But your patient hypertensive, patient having the pleural effusion, reaction, not reaction, rather to say mild pleural effusion, blunting of the angles.
Is
The
Left heart
very
failure.
Bat's
pulmonary
wing, yes, pulmonary
edema.
edema. Now management in exam. What will be your management now? You are AKT or OSCE, whatever it is.
The diuretic,
Diuretic,
Lasix infusion or Lasix.
Lasix. So your GP, will you give the Lasix in the chamber and or after giving the Lasix or furosemide, then send patient to the emergency?
Refer actually. If in the GP, obviously you will refer.
Yes, refer. So why you are telling Dr. Javadi if you are GP? We are all at GP today, doctor. So think in this stand that I am GP and I will do it. So
So,
correct answer is diagnostic answer, acute left ventricular failure due to uncontrolled hypertension, and management will be urgent hospital treatment. Okay, because there is a Bat's wing appearance is there, active disease. So this could be the extra trap for your exam and others. So you may think, I'm going back to describe you. You may be busy with this wire. You will explain this wire so and so. You may be busy with this little pleural effusion. But main agenda will be bat's wing appearance, the pulmonary edema. Accordingly, we will make our management plan. So next, chest extra trap 3. What you are looking there in your hypertensive patient? Could there be any further tricks? Please look at, already you attended our many X-ray sessions, I know, but today this is your time to say. What you are here getting, doctor? In the chest
Tracheal
X-ray?
deviation
Tracheal deviation with
enlarged heart.
enlarged heart also. So this is an appearance. There is a consolidation, okay? Tracheal deviation is a matter of further explanation. Right-sided trachea is could be, the trachea could be deviated naturally to the right a little. And you can go through our X-ray discussion, technical adequacy of the chest X-ray. They can explain you detail. But simple tips is from the spine to the clavicle. If the distance is same, then we can say there is no technical abnormality. But if there is a problem of the distance, at that time trachea may be visible as shifted to the left or right. Okay, if this is consolidation, there may be air bronchogram. More likely it is consolidation of the upper lobe in the right side. Horizontal fissure is there. So though I am having a patient of hypertension, I am following the patient up, it doesn't mean that patient will not develop pneumonia. So these are very gross findings. This type of X-ray also can be given in your hypertensive patient. So don't think that it is left ventricular hypertrophy. No, or sorry, nobody will tell left ventricular hypertrophy. This white thing, white shadow should not be missed. So in this way, what you are thinking now? Aortic dissection or consolidation or whatever you say. It could be, sometime it could be widening mediastinum. Okay. Though I'm sorry I couldn't open you of mediastinal opening. There could be aortic dissection. Big sized aorta can confuse you with the consolidation also. Okay. But more likely this could be consolidation. Aortic dissection appearance will be a little different. So aortic dissection could be a complication of the hypertension. It is very, very true. Okay. So I'm not telling this X-ray is not pneumonia. Rather, be careful about widened mediastinum at that time. Try to identify aortic dissection. Don't be confused. In this type of X-ray, straightforward, this is pneumonia, no doubt. Okay. Then your emergency treatment plan will be there. Now the X-ray trap 4. Have a look, doctor. What you are thinking, what you are looking here. Your patient have hypertension. Please, doctor.
Tubular heart.
Tubular heart. Heart is down, doctor. Heart not in this area.
It's widened mediastinum.
Widened mediastinum. So what you are thinking now with the widened mediastinum? It is due to pneumonia or due to hypertension?
The hypertension leading to dissection of aorta.
Dissection of aorta, right. So if it is a pneumonia, then differently. Possibly I need to, this slide correction should be there. Dr. Javed, can I take 1 minute? You should not be confused. These X-ray, I think better to be here. Pneumonia X-ray is here. Right, Dr. Javed, please guide me if I am wrong. Actually, there might be misplacement. Then it will be easier discussion for you. I actually explained in a very complicated way before. So this is the, not this one, rather to say, aortic dissection. Good discussion will be there with this picture. Aortic dissection, and we are giving the emergency management. Now the trap 4 here will be from there. Sorry, just a little confusion here at my slide. This slide. Okay, Dr. Javed, can you hear me, doctor?
Yes, Dr. Smart.
Okay, so this is a consolidation and it is not due to hypertension. It is not due to hypertension. Directly due to hypertension or not. So it is pneumonia is not a direct outcome of the hypertension. Patient can ask you it is due to hypertension or not. So widening mediastinum or pulmonary edema we are discussing today. This is the actually memory of today's discussion that Bett's wing appearance is pulmonary edema or pulmonary, not hypertension, sorry, not pulmonary hypertension, pulmonary edema, or we can say indirectly left ventricular failure. And then widened mediastinum. Widened mediastinum can confuse clinically with coronary artery disease. There may be associated coronary artery disease also. The great mistake will be if I think this is coronary artery disease, that means the myocardial infarction due to coronary disease, but underlying dissection is there. Great mistake could be there. I am giving aspirin, I am giving thrombolytic therapy, and patient would die immediately. Clear, Dr. Javed?
Yes.
I think clear. So it should be very clear. Thank you very much, doctor. Any query until now?